మీ పిల్లలు ఫారెన్లో చదవాలనేది మీ కల? మీ కలను నిజం చేసే ఏకైక సంస్థ విదేశ్ కన్సల్ట్స్.
So it was a wonderful seeing you on ramp. It was the first time you were walking on a ramp, and how much it was struggle, or because you always make nervous to other side. But today you were nervous on the ramp.
No, I'm not nervous. I was walking with a cancer survivor. The girl was very cute.
Yes.
And I think it's a privilege to walk with somebody like that.
And okay.
Yeah, so it's just a normal walk.
And how you see these awareness campaigns? How you want on the higher level to be promoted?
No, I think these are very important because I think medicine now is progressing rapidly. Cancer is curable in most of the cases. In fact, there are very few cancers which are not curable. That is because they're detected late. Every cancer detected early is curable now. So therefore, public awareness and participation in this cancer detection is very important. We now have what is called the 4 P's of medicine. Precision medicine, we have the preventive medicine, and we have personalized medicine. And the fourth important thing is participation. These 4 P's are the ones which is now driving oncology or cancer medicine. And it's my belief by 2050, most of the cancers are going to be curable. Maybe earlier also. Because in the last 4-5 years, there's been huge advances in detecting cancer early by biomarkers and genetic mutations. Also in treating them with very effective therapies like immunotherapy and non-invasive technologies like endoscopy. Most of the cancers can be very effective. There are very few cancers which are now not curable, and that only at the late stage. So by 2050, our aim is to see that all the cancers are curable. They'll become like what infectious diseases are today, like tuberculosis and so on. The average lifespan will then go up at least 5 years in the general population.
Yeah, and that's a very good point you said. So now we don't see an age, but earlier we used to see only a certain age group used to get cancer. Now there is a no age group. How it's curable and what are the symptoms we can go about it?
There are certain cancers which are very classic of childhood. Leukemias, for example, blood cancers. Similarly, cancers of the kidney called the Wilms tumor or lymphoma. These are very characteristically seen in childhood. In the adulthood, of course, we see a variety of cancers. Many of these cancers are linked to environmental toxins. And of course, like cigarette smoking, alcohol, I think environmental contaminations, all these are leading to cancers. So we believe that as we identifying the cause of the cancer, now the problem is why everybody doesn't develop cancer. Everybody is exposed to same toxins. It is because of a certain genetic makeup. Some people who have a genetic mutations are more vulnerable, those are not. Present now we are able to identify what are these mutations. We can take a blood sample of a person, run it in a DNA sequencer and tell you which cancers are susceptible and you have to be careful about. And many of these cancers now, because of screening techniques like breast cancer, lung cancer, colonic cancers, we have regular screening programs which can detect and cure these cancers at a very early stage.
And so there was a news happening around, I don't know how true it is, that one medicine will come and you can cure a cancer. How true it is?
It's not a single medicine. Cancer is like it's not a single disease. We say cancer, but each cancer is separate. So there are separate medicines for blood cancers, and even among blood cancers there are 20 types, and each cancer has got a separate medicine. The separate medicines for lung cancer, different types. So each cancer has got a separate medicine because cancer is multiple diseases which come under the same terminology, just like tuberculosis or typhoid and so on. Each of them have different.
So I think in the future, as you said, you give a hope that it will be curable. So what exactly you would like to say and give tips so that we can go on a higher side to cure it?
No, I think the basic tips still stand for people that for preventing cancer, they must actually have healthy lifestyles, diet, exercise, avoiding toxins in your food. These are all very common. Especially simple thing like exercise has shown to prevent cancer in 30% of the people. So I think these are fundamental things that has to be followed. And also look at the cancer screening programs, how breast cancer can be prevented in women, how colon cancer can be prevented in men by undergoing, say, 3 yearly colonoscopies. So once you follow those rules, your chance of developing a cancer of known cause is very less. There are certain cancers still, like pancreatic cancer, where we can't diagnose early, where we don't have any methods of screening. but most of the cancers, 70% of the cancers can be screened and detected early.
So can we see, sir, last question to you. Is any technology will come up where a test can be done on daily basis without any like people get scared? Oh, test. So is any particular?
That's a very good question. There are now what are called biomarkers in the blood.
Okay.
Just simple taking a blood sample,
Like a diabetes we do.
like diabetes we do, we can check for 25 cancers
Okay.
and then tell you what is the, not only whether you have this early cancer, but are you likely to develop this in the next 10 years?
Okay.
In fact, we are now doing what is called a personalized medicine test where all people donate their blood for testing.
Yes.
After 10 years, all those who develop cancers, we have the blood sample. We can check what abnormalities were there which we couldn't have detected. And after 10 years, the practice of medicine is going to change totally.
Okay.
We are going to have this personalized medicine and tell you 10 years before that you're going to develop this cancer in next 10 years.
And what is the age group you advise to go for this?
So we would say starting from 30 years, you should start going for this. Yeah.
And it's available, like we can go for it, or it's upcoming technology?
It's still in research. In a few years' time, we'll get it now.
Wow, that's a good, very good initiative. Just again to all the viewers for today, what do you have to say? Like today was a men's theme. So there was any preparation from your side? Your family was saying, Dad, you wear this, or Grandpa, you wear this.
No, it's not that. I think men and women are equal now. There's no difference. It's just that we have an occasion to celebrate certain days. But I think women are contributing equally and we're all same now. Same species with same genetic material basically.
Thank you so much, sir. Thank you.